All right.
Okay, looks like we're all set. Um, Hi, everyone. Thanks so much for joining. I'm really excited to share today a little bit about global health education opportunities, specifically for Elizabethtown College students. So we're going to be talking about summer and then onward into the fall and winter. And I know that some of you sent in questions, but I want to make sure that I leave time at the end to answer those. So my name is Robin Young. I'm the managing director at CFHI. I've been with the organization for almost 6 years now, and I've served in various capacities. When I first began with CFHI, I was most directly supporting our programs on the continent of Africa and in the Philippines and India. And for the past several years, I've been in more of a general managing role supporting all of our global partners around the world. So I'll tell you a little bit about all of their work in just a moment. First, I wanted to just give you a little bit of an overview about Child Family Health International as an organization, because the work that we do in terms of providing global health education opportunities for students is a little different than some other providers of these types of experiences. So I'll tell you a little bit more, just really briefly, about sort of our ethos and our approach to global health engagement for students. Um, a quick overview, we've been offering global health education programs for 27 years now. We've sent well over 12,000 students on our programs around the world, which are now located in 12 countries. Of course, everything is virtual right now, and I'll speak a little bit more to what the summer may look like during our session today. Our model is really rooted in partnership with experts around the world. So they're actually doing the teaching and helping you to develop the global health competencies that our programs focus on. So when I say that we have, supported clinics, hospitals, and NGOs, what I mean is that through fair trade engagement and partnership building, we have had longstanding supportive relationships with clinics, hospitals, and NGOs around the world. So our program locations are in India and the Philippines, as I mentioned. On the continent of Africa, we work in Ghana, South Africa, Tanzania, and Uganda. In Latin America, we're in Argentina, Bolivia, Costa Rica, Ecuador, and Mexico. And then in the US, we have more recently launched programs in Hawaii. And we have piloted a program in California that we're exploring if it will, and if and how it will be continuing into the future. So local global health. But one of the reasons that students, but especially academic institutions, universities, health profession schools, et cetera, seek out a partnership with CFHI is because we're sort of recognized as a program provider that focuses on ethical best practices for student engagement in global health. Unfortunately, there are a lot of opportunities out there for students to engage unsafely and unethically with global health, and in ways that really do not look carefully at the innate power imbalances that exist when students from the global north travel to the global south for seeking health experiences or medically focused experiences, right? So we seek to safeguard and ensure that host communities are protected from individuals or students intentionally or unintentionally, almost always unintentionally, causing harm, which can happen when we're practicing beyond the scope of our training, when we are unintentionally overshadowing local healthcare systems or local health experts, or things along those lines. So some of the ways that we do this have included setting up programs in the framework that I mentioned earlier. So seeking fair trade partnership with all of our global partners and ensuring that students are only offered appropriate and appropriately supervised opportunities in global health. And then also seeking to better understand and document what is happening in the greater field of student engagement in global health. So we've done a lot of work, collaborative work with many institutional partners and many of our academic partners to publish on this topic and help to move the dial forward to ensure that students are engaging ethically in global health opportunities, not only if they're traveling through CFHI, but also just in general on their own campuses and beyond. So to reiterate, our approach to global health always emphasizes existing health systems and resources. So we're never offering students an opportunity to travel and set up a parallel health system. That's because there are existing health systems that we can learn from. And part of our role is to identify those outstanding health leaders in the various countries where we run programs and give you the opportunity to learn from them, right? We're always focusing on assets and positive efforts that exist within communities. So not to deny challenges that exist in the host communities where we work. And of course, we know that even the US medical system has substantial challenges. So we're not denying that challenges exist in health systems or gaps in care don't exist, but rather saying, let's identify where the good work is being done, who are the leaders doing it, and offer you an opportunity to learn from them and partner with them. We're always holding up local practitioners as the experts of their own environment in global health settings. And as I mentioned, we're practicing fair trade learning and partnership. So you're embedding in a clinic in Uganda, for example, but that is embedded within a much longer standing partnership with CFHI, right? So that you're not just coming in and leaving a vacuum when you go, which we know is one of the pitfalls of global health and development engagement, but rather you're sort of tying into an existing structured setup that focuses on not only the practice of medicine, but also really the development of a whole slew of health competencies that we'll talk about in a minute, and offers you an immersion opportunity. And I should say in the virtual space, we worked really hard with our global partners to replicate a lot of those immersion type opportunities in a variety of ways. So I mentioned earlier, global health competencies are not just clinical. Of course, clinical skills are really important. And I know that all of you are seeking to hone your clinical skills through these types of opportunities, but it's really important to notice, and one of the things that we focus on at CFHI are determinants of health. So this is just one example, taking, for example, determinants of health and their contribution to premature death. So if we look at this graphic, we see that in terms of proportional contribution to premature death, genetic disposition is 30%, social circumstances 15%, environmental exposure 5%, behavioral patterns 40%, and healthcare is just 10% in terms of those outcomes, right? So this is why, going back to this slide, we say that clinical skills obviously are incredibly important, but when we think about global health, there's so much more to be learned and so many more competencies to be honed than just those clinical skills. And in a global health setting, those other competencies really are the bulk of what we're able to develop, right? And this is taking advantage of the fact that we want to ensure that you're never put in a position where you could be harming a patient, and taking full advantage of the fact that this is the perfect opportunity to develop some of these other domains of global health competencies. So things like global burden of disease, professional practice, globalization of health and healthcare, looking at health equity and social justice, and developing a deeper understanding of those concepts. We already talked about determinants of health and how a deep understanding of those upstream factors are crucially important. Program management, capacity strengthening, collaboration, partnering, and communication. You would be surprised how important this is in a global health setting, but of course, it's really important in our domestic local settings as well, right? Understanding our patients, understanding how to communicate with each other as professionals, et cetera. And then ethics really is an underpinning domain for all of these. So these are some of the competencies that we seek to develop for you and partner with you as you develop these during a CFHI opportunity. So I'm going to dive right in and talk a little bit about virtual opportunities with CFHI. And I should preface this by saying, and I doubt that this will come as a surprise to all of you, though place-based, travel-based programs are still listed on our website for summer. We, like everyone, are in a final sort of evaluation process of the feasibility of supporting student travel for the summer. And unfortunately, it's looking like it will be difficult to fully reopen our place-based programs for this summer. We're more optimistic about the fall. But of course, like everyone, you know, we feel tremendous weight of responsibility for feeling that we can confidently ensure your safety and well-being during a global health education program. And really the same goes for our host communities, right? So we're, you know, and this is really a global health reality. We're starting to see more and more students reaching out to us saying, hey, I'm going to be fully vaccinated by this summer. You know, what are my options for travel? And we're really, we're feeling really hopeful about that. And of course, you know, our final decisions have not been made, and we're making decisions on a country by country basis, of course. But you know, we have the burden of care for our host communities as well, many of whom are more vulnerable or have more vulnerable health systems, rely on prevention as a primary source of addressing COVID, for example, rather than, you know, treatment or hospitalization. So in some ways, you might say we actually have a higher responsibility than if we were just considering student safety alone, though of course your safety and well-being is our highest priority. So to that end, we'll be making final decisions for summer programs by the end of March at the latest. If you're already enrolled through our system in a CFHI program for the summer, then you'll get an email directly from us saying, hey, your program will run, or hey, your program's not going to run. Would you like to postpone? Would you like to withdraw? Would you like to switch to a virtual opportunity? And we'll give you those options. If you're not yet in our system, then you can check our website. We have a COVID page on our website, and we will update that as soon as we make a decision. I can also be in touch with Megan, and of course she can you know, update you as well once we make final decisions. And like I said, there's a chance that we may be able to run, you know, a limited offering in 1 or 2 countries, and maybe not the remainder of our countries. So that kind of remains to be seen. So I guess before I dive into the specifics of virtual programs, and then I'll talk about our place-based programs as well, I should pause and just see if there are any questions in the meantime. For joining. Okay, great. Can you all still hear me? Yeah. Okay. I'll just move ahead then. Feel free to stop me. We're a small group, so no problem if you want to interrupt and have questions. So I'm just going to go over a couple of the virtual learning opportunities that we've developed in collaboration with our host community partners. One of the great things about always, you know, having a long history of being a partner-centric, sort of fair trade rooted organization is that when we had to bring everyone home last March and make a quick pivot to virtual programs, we were able to do so in a way that still really features the experiences and expertise of our global partners around the world. So one of the offerings that we put together are these virtual internships, and these are really specifically place-based. So, you know, through our website, you can enroll in a virtual global and public health internship in Uganda or India or Ecuador, or any of the countries you see listed here. You will be working most closely with our leadership in that country. So these are medical doctors, in some cases, nurses, community health workers, health administrators, you know, some PAs or sort of PA equivalents in local health systems. as well as sort of just cultural experts and others who can help to create that immersion experience. So during these internships, students are having live synchronous sessions throughout the week, as well as doing some independent work, reading, group work. You'll be learning about the burden of disease in that country. You'll be learning about determinants of health in that country. You'll look at health from a few different topics. All the programs sort of give a health systems overview, looking at US comparatives. We have a weekly lecture that's run by our US based executive director, Dr. Jessica Everett. And so she sort of offers like the US comparative perspective, as well as some global health 101, you could say. So introduction to the concept of burden of disease, for example, is a lecture that she'll give. So Morgan has a question, and I think this may best be answered by the Elizabethtown folks. Can these programs yield patient care hours if we need them for PA school or med school?
Yeah, so I'm not sure if Lisa's able to jump in or not. I know the PA program is still pretty new, so I'm admittedly still learning all the requirements. I know that we've talked to Child Family Health International about being a potential provider for our master's level PA rotations. That's not currently finalized, but it's something I think that's still on the table for the future. So I don't know about the undergraduate part of it right now with you being in the accelerated program, but if you plan on staying at E-Town for master's level, it might be an option, but I'll definitely circle back with the PA folks and see if that's a possibility.
Sorry, Megan, I was muted. We will have a master's program at some point. Our first cohort just started in January. So we're just hitting the ground running right at the moment. So we're not prepared for anything else right at the moment, but definitely in the future, we have begun, believe it or not, we have an international collaboration coming up with King's College. And we'll certainly send those opportunities out to the rest of the campus. But again, those are just like synchronous sessions, nothing else too fancy, but for sure in the master's, that would be a definite possibility. So the launch will be in January of 2023.
Awesome. Thanks, Lisa.
Sure.
Thanks for clarifying that. So participants in this virtual internship have the opportunity to learn from local experts. We have a medical director in each country. They have a cadre of preceptors and sort of local experts on different topics who they bring in to give you an overview of local burden of disease and healthcare challenges and realities. Many of these programs also incorporate the opportunity to sort of network or even offer project-based help to local NGOs. Depending on, the timing and the availability, there are different sorts of opportunities available. We've had interns who have helped put together, literature reviews as background for grant proposals that NGOs are working on, do some data analysis. So it really just depends on what the local needs are. But this is an opportunity to develop strong relationships with the leadership in each of these program countries. So it's kind of a unique opportunity in that way. Here you see Dr. Charles Mwobu, who's our medical director in Ghana, Ms. Hema Pandey, who's our director in India, and Dr. Cecilia Uribe, who's our medical director in La Paz, Bolivia. So I also wanted to share that we have a comparative opportunity. So if you were thinking to yourself on the last slide, well, how would I choose? This might be a good opportunity. This is a virtual internship where you sort of spend time in each of 3 or 4 countries for the duration of your program. So you choose one country where you're doing a deep dive and spending most of your time each week, and then you'll have comparative lectures or maybe even a health comparative roundtable each week that all of our medical directors sit in on, or a number of them do, share perspectives on a specific topic from their country. So we've had roundtables on COVID responses in our different partner countries. We've had roundtables on maternal child health approaches in the various countries where CFHI has partnerships. We've had roundtables on last mile health and, the role of community health workers. So it's a really interesting opportunity to sort of gain perspectives, and just to share, when we've run COVID panels, there are really interesting perspectives from different countries. You wouldn't necessarily, or I might not necessarily have thought of Uganda as holding, unique expertise in terms of preventing COVID, but it turns out that Uganda has been uniquely successful in preventing COVID, in part because they have so much experience, decades of experience preventing Ebola, and addressing, the Ebola outbreaks that have been somewhat continuous in the neighboring Democratic Republic of Congo, or DRC. So that unique experience is something that Uganda's, public health experts have brought to the fore. Our medical director in Uganda, Dr. Nanguyo, has been really involved in COVID-related public health campaigns. He does a weekly radio program that he was asked to develop as soon as COVID began. So there's some really unique sort of local expertise and knowledge that you can gain from these comparative roundtables that we've been offering. And on weeks when the roundtables aren't happening, then we'll put together, lectures from a comparative country or a medical director in another country where we work. So, we've had our medical director in the Philippines speak, or really there's a variety of sort of types of expertise and focus areas of expertise that our leadership around the world offers. So this is a great one if you sort of want that comparative perspective, I guess. The virtual elective really could certainly be of interest to especially health professions and PA students. So this actually is an interdisciplinary opportunity, virtual opportunity. Right now we have medical, PA, nurse practitioner, allied health residents and fellows enrolled. The electives are kind of like a now opportunity. So if you're interested in participating in something that's taking place, before, through the end of May, this is a really cool opportunity, and we're evaluating whether we can offer it again in the fall. We hope to, and maybe even at a selected time or two during the summer. But this elective highlights how health systems are delivering healthcare in diverse environments, taking into account culture and cultural realities. This really focuses on low resource decision-making or lower resource decision-making, drawing on a number of case studies from a book that's coming out that we co-authored called Reasoning Without Resources. And of course, our global partners and leadership around the world are best suited to speak to sort of clinical decision-making in differently resourced settings. And there's a whole component, and I should say this is true of all of our programs, around expanding self-awareness. So you will have access to several different intercultural skills development tools through our partner, Aperion Global. Aperion has developed a tool called GlobeSmart and a number of assessments, including self-assessments. These have historically been used in the business world. They're sort of one of the go-to training, trainers and resource providers for like Fortune 500 companies, business travelers, that type of thing. And they've recently expanded much more significantly into the academic space and offering intercultural tools and resources for students and for academia more broadly. So we're lucky enough to partner with them. So everyone who enrolls in one of our programs, virtual or place-based, gets access to this suite of tools that is tremendously useful in developing greater understanding of yourself, your own cultural values, your communication style, and thinking about those in relationship to your host community or host communities if you're doing a comparative body. So we've gotten such good feedback about that component. And so expanding self-awareness is a really important part, I think, of developing global health competencies. Sorry, if you hear my cat meowing, working from home. So part of this, part of this program too, really will help you to develop deeper understanding of how, you know, our partner communities are addressing pressing health challenges, looking at chronic disease, maternal child health, infectious disease, reproductive health, to name just a few. Always looking at the interplays between, you know, the clinical realities and the public health realities and how those speak to each other. Virtual electives are 3 to 4 weeks in duration. We tried to make them really flexible because we know that, you know, PA students and other students have relatively inflexible schedules. So you can select 3 or 4 week duration, and currently the elective is starting every Monday through the end of April. So that's an opportunity to think about. I know that that's kind of like a now opportunity, but I certainly will be in touch if we're offering it again in the fall. I also just wanted to flag our practicums. These are a virtual opportunity that has been really interesting and has sort of evolved over the year that we've been developing it and honing it with our partners. So this is for students who are really seeking more of like a one-on-one mentorship opportunity with our global partners. One of our global partners. So usually you're partnered with a preceptor or one of our medical directors as your mentor. We come up with a really specific project that speaks to your skill set and your interests. And then it's a relatively independent project opportunity. And then you're having weekly mentorship Zoom meetings with your mentor preceptor. And then at the end, you're delivering, you know, a pre-agreed to set of deliverables, whether that is a, you know, set of health education materials, whether you're maybe reviewing a document, maybe you're looking at data in some capacity, maybe you're helping to develop corollary materials, maybe you're putting together some background research. But the idea is that it's a project that directly supports the ongoing work and efforts of one of our host community leaders, usually our medical director or one of their preceptors, for a clinic, for an NGO, for a hospital. So you get to hone your professional skills. They get some deliverables that are really helpful in terms of an ongoing initiative that they're already working on. And it's kind of a win-win in that way. So that's a little bit more of a tailored sort of one-on-one experience that has really been of interest to some students. We found that you know, we've had undergrads enroll in this. We often see master's level, like MPH or capstone seeking students enrolling in the practicum, but it's not exclusively that. Sometimes we'll have, you know, if a student comes to us really interested in research, for example, often we'll end up putting together a practicum or a project under the banner of practicum. So a few examples of the types of projects that students have done with their virtual practicums. In Uganda, some of the themes include WASH, you know, which of course is sanitation and hygiene, nutrition, maternal child health, HIV/AIDS, dental and oral health, sustainable ag. So some students have done a lit review suggesting strategies to help, you know, a particular component of one of our partner programs achieve the 90-90-90 UNAIDS goal, developing contextualized education materials about critical indicators for neonatal health to be used by midwives. In Bolivia, we've had students develop training guidelines for working with families of HIV positive children. In India, we've had students evaluate whether evidence from mobile phone interventions for adolescent sexual reproductive health are sufficient for scaling up. So these are sort of just some examples. And of course, these have been tailored to speak to students' backgrounds and expertise. We do have scholarships to support our virtual programming. The next deadline is March 15th. So if you look at cfhi.org/scholarships, you'll see all of the opportunities there. To apply for a CFHI program, it's a relatively short application and applications are accepted on a rolling basis. Right now, just due to COVID, we're waiving the application fee just to make the process a little bit more simple. So there's normally a $45 application fee that's waived right now. And then all of the virtual programs that I just spoke to you about, they do carry fees. And of course, that is directly related to our fair trade commitments with our partners. So anyone who's involved in teaching you, preparing sessions or seminars for you, if you're engaging virtually with an NGO, then there's a donation being made on your behalf to that NGO, thanking them for their time and their preparation that they put into it. Several of the virtual opportunities I mentioned have cultural components, so maybe a virtual cooking class, virtual city tour. So all of those things are compensated fairly. With that said, we try to keep the fees as low as possible because we know that students carry a lot of financial burden as it is. So the 4-week virtual programs I mentioned are between about $500 and $1,000 for 4 weeks. So I'm going to go on and talk a little bit about place-based programs, but I'll pause and just see if anyone has any questions about the virtual programming first. Okay, looks like no. Oh, Megan, were you gonna say
No,
something?
I was just gonna ask a quick question if the virtual programming is something that you see continuing beyond the pandemic, if that's something that might continue to be available.
Good question. We really do. We're feeling more and more committed and inspired to maintain a hybrid model going forward. What we've seen with the virtual offerings is that they're helping CFHI to sort of walk the walk in new ways of our sort of fair trade mission and place in the global health education space. So we're finding that a diversity of students have been able to participate who may not have had access to global health education programs before because the fees were too high or travel was inaccessible. So we've been really excited about that. We're also finding that many more students from the global South and low and middle income countries have been able to participate in our programs in a way that they were not necessarily able to before. We're excited about the virtual space because it reduces our carbon footprint. So while we're huge believers in immersion experiences, we also really feel the weight of responsibility for sending 1,000 students on planes all to the other side of the world each year. So that's something that we're thinking about. So yeah, I think that's a great question. And in a nutshell, we do plan to continue to offer virtual programs even after we can reopen place-based. It may not be the exact portfolio of virtual programs that we have now, but I know that the ones that have sort of risen to the top and been most popular and sort of most successful in terms of student learning and partner satisfaction, global partner satisfaction, will remain. And those basically are the ones that I highlighted for you today.
Awesome. Thanks, Robin.
Yeah, thanks. Okay, so moving on. Let's talk about place-based programs. So I kind of gave you the overview already about summer. And if you have any questions about that, please just follow up. But essentially, when we're sending you on a program, we're embedding you in a local healthcare system. So this is an opportunity to, depending on the program, live with a homestay family or live sort of in more of potentially an apartment or a dorm style accommodation. Where we can safely do homestays, then we do homestays because it's the most immersive opportunity. But in some locations, that's just a little bit more difficult, either culturally or from a safety perspective. So sometimes we have more dorm style or more apartment style living with maybe a caretaker living in. Our programs are pretty they're great if you've spent a lot of time traveling, and they're also a really good option for students who maybe have a little bit less global experience because, we do arrange your housing. You are picked up at the airport and dropped off at the airport at the end. 2 meals per day are provided. So it's a really sort of supported program, if you will. And then during the day, you are embedded in a local healthcare system. So depending on the program, you may be at one clinic or hospital, or you may be throughout the duration of your program spending time in a variety of settings. We call that a little bit more of a survey program, or a comparative, where you're getting to know the differences between a small community-based clinic and a large referral hospital, for example, or learning about, civil society and sort of non-governmental organization contributions to health, or public health contributions, visiting some public health agencies, that type of thing. So it depends on the program. You probably noticed I have a lot of programs listed on our website. So it can be really helpful just to, seek it out either by your geographical area of interest, or if you have a topic area of interest, the program titles usually are good indicators of, if you're interested in palliative care or maternal child health or infectious disease or the hospital setting, those are usually indicated in our program titles on the website. So I just thought I'd highlight one or two programs here, and this is by no means all the programs we have, but just to give you a little bit of a brief overview. So this is our maternal child health, HIV and realities of health access program in Uganda. This is a semi-rural program in Southwest Uganda. You rotate at a number of local clinics. Our partner there, the Kigezi Healthcare Foundation, runs a maternity clinic, an HIV clinic, and a general clinic. And then they also partner with a couple of local clinics that you have access to as well. So you're never going to be directly responsible for patient care, just because the resources are so different, the language is different, the cultural approach to care is really different, the training is different. So to just throw you in there and ask you to be responsible for patient care would be not fair to you and not fair to patients. With that said, obviously you would be right there, what we call really engaged observation. So you may be asked to help with charting, you may be asked to help even something like a blood pressure reading. The main thing is we don't want you to be responsible in the off chance that the blood pressure reading is read incorrectly, that can have consequences for the patient's care, right? So we always want to make sure that your work is being checked by a local healthcare professional, whether it's a nurse or a community health worker or the doctor. And we're never putting you in a position where you may inadvertently cause harm. So that's sort of our commitment, to making sure that we're keeping you safe and also keeping our host community safe. But when I say observation in a clinical setting, you may picture sort of sitting back in a corner and zoning out. And that's not at all what students do on our programs. It really is engaged. There's active dialogue with your preceptor. You're learning about the local burden of care by seeing it firsthand. You're directly experiencing how cultural factors play into what shows up at the clinic, right? So it's a really, really interesting opportunity. This program is great for students interested in rural or semi-rural healthcare delivery, health outreach. Our partner also does a number of health outreach activities each year with much more rural communities. Some of them you have to hike to, so quite rural. This program has dorm style accommodation. And this program is interesting because you'll also have some focus on agriculture and nutrition built in. They have launched, for example, a rabbit breeding center, and this is based on models from elsewhere in East Africa. Basically, they found that families, but especially children under 5 in the Kabale region, were protein deficient, and essentially needing more meat in their diet was one of the ways that they determined to help address this. Chickens were really expensive because chicken feed is expensive, but what they found is that rabbits eat the vegetation that grows naturally in the Kabale region because it's very rainy. So, green sort of herbaceous things that grow on their own are rabbit food. So they developed this whole program to breed and train families to breed rabbits, basically. And they're running that program. They're also working on putting together a system to evaluate how well it's been working. So there's a lot that's really, really interesting going on, and sort of a lot more than just the clinical setting happening on this program. this is Dr. Angulo. He's the founder of our partner organization there, and he's also our medical director. In New Delhi, our program focuses on public health and community-based medicine. So this is a little bit more of a survey program where you spend time at a wide variety of non-governmental organizations, as well as public health organizations and initiatives. Themes range from sanitation and hygiene and WASH, HIV/AIDS, gender, lasting impacts of the caste system. So this is a really interesting program to take a look at all those themes. Cultural immersion in historic Delhi, you stay in an apartment with a caretaker and use public transit to a great degree. So this program is really interesting. When I visited, I was really struck by some of the innovations in approaches. So one of the organizations that you visit, they've sort of tackled an issue from two sides, which has been really successful. So essentially, this organization determined that there was an issue with lack of adequate sanitation and hygiene in a number of communities due to households not having access to toilet facilities, basically. So there's defecation in the home, and many homes were employing a group of women known as scavengers, which were of an untouchable caste. The caste system is officially no longer legal in India, but de facto it still plays out in many places. So you had the issue of, open defecation or defecation within the home without adequate facilities was causing sanitation, hygiene issues, and illness as a result. And then you also had this perpetuation of an untouchable caste because women were employed to remove human waste from homes, and therefore considered untouchable because they're doing this job. So that's a really complex issue. I think it's a really good example of a true public health challenge on a grand scale. So there are a lot of organizations looking at these issues, but one organization that we partner with there had said, okay, let's tackle it from all sides, right? Let's both put together a low-cost composting toilet that can be installed on blocks and shared by families, and maintenance is easy, and there's easy training to go along with it. Okay, we're kind of starting to address the sanitation and hygiene issue, but then we've removed the vocation of all of these women who were providing this service. We've taken jobs out from under them, right? And that's a problem too. So instead, they put together a vocational training program to retrain this group of women so that they're doing henna design, sewing clothes, and a number of other sort of important skills. And so not only are they sort of retrained and have a vocation, but then also tackling some of the lingering issues of the caste system or the perception of women as untouchable in certain castes. So that was really interesting and eye-opening for me. I think it's a favorite of students who visit the program and, talk about determinants of health, right? This one is, a really clear sort of indication of all that happens outside the hospital before a patient ends up in the hospital. And as I mentioned, Hema Pandey is our director in India. And then the last program I'll just touch on briefly is in La Paz, Bolivia. So this program focuses on pediatric and adolescent medicine. Students rotate at community clinics and health centers. La Paz is a beautiful cosmopolitan city, really interesting, sort of uniquely. The wealthier communities are located down in the flats, and more of the slum type communities are in the mountains. That's a little bit unusual. You often see that reversed if you think about most cities that you may be familiar with. So that's sort of just an interesting tidbit. And they've put together trolley systems between the mountains and the flats. So you'll learn about local burden of disease from the experts, explore La Paz. We do have host family lodging in La Paz, and you take Spanish classes at a local language school as part of this program. And Doctora Cecilia is our medical director there. She's wonderful. So I'll stop there. I've spoken a lot, and I want to make sure that I take time to answer any questions that you all have. And thank you for your time.
Yes, thank you, Robin. I appreciate it.
My pleasure.
Yeah, any questions, everyone? feel free to unmute yourself or write them in the chat. As I say, I know Morgan is from the pre-PA program. That's a new program for us. And then Carly is actually occupational therapy, which is a really big long-term program for us. So definitely a lot of biology, allied health, the new nursing program is starting soon. So definitely a lot more health professions on campus for students that'll be interested in these programs.
That's great. And we have, Carly, remind me which program I know you were interested in one in particular.
Yeah, I was just looking at summer programs, but mainly the planetary health one in Costa Rica. So I was just going to ask about summer things, but you had already covered that.
Okay, great. Yeah. Yeah. So the Costa Rica program is amazing. Their expertise, as you've already hit on, is in planetary health. So that's a great one if that's an area of focus for you. In terms of OT, we have a couple of partner organizations in La Paz that are able to offer a little bit more of an OT focused rotation. So if you end up deciding, to seek out a travel-based program, and you're specifically looking for a more OT focused rotation, then, well, we should just talk. Let's just be in touch about that. And we can try and put that together. I can connect you with our director in La Paz or, Costa Rica to get your questions answered. But yeah, I think there are some really good options there. And even in the virtual space, if you wanted to have a little bit more of a focus on OT through one of our virtual programs, then we could probably organize that as well. So just reach out to me if you want to have a chat about that.
And Robin, you may have already mentioned this, but what is the time commitment for the virtual programs? Because at this point for in-person programs, our students are definitely looking at more summer, winter break. I think there might be a few that align with our spring break. So we're definitely looking outside of the typical semester at this point, but I'm wondering with the virtual experiences, if there might be the ability to do them simultaneously.
Yeah, definitely. So I would say for virtual, we do have students doing things simultaneously, and simply, like, if they're not able to attend one of the synchronous sessions, then we are recording everything. We're asking students to attend everything that they can, but if they truly have a conflict, like with a class or something, then we do record, and we're using Google Classroom so they can catch up on everything in their own time, after class is over. The virtual elective, I believe the time commitment is around 10 to 15 hours a week. And that's one that is definitely taking place during the normal term. It's not in summer. It's not offered in summer right now. And the virtual internships are more like 15 to 20 hours per week. And that's a mix of synchronous and asynchronous components. So it would be more like 6 to 8 hours of live sessions. We would hope that students can attend most of them live. If they have to make up, one session per week because they have a class conflict or something, then that's fine. And then the rest of it is sort of independent work, so, completing the online modules that I mentioned, that type of thing. So we definitely are seeing students layer in the virtual opportunities on top of their existing class schedule and work. And we've been trying to be really flexible and work with students to make that happen as much as we can. But I will say, like, that for the elective, for example, we did try to set that up so that it would coincide so that some students, specifically medical students, could do it as their elective and have it be the main thing they were focusing on for those 3 weeks or those 4 weeks. But it hasn't been the case for all enrollees, and they've still had a successful experience.
Thank you. I appreciate that. Any other questions? I know, Morgan, we kind of got a snapshot of the Uganda program that you were looking at, so that was hopefully helpful. Any other questions at this time? Awesome. Glad you're able to join us, Lisa.
Thank you. Yeah, really glad.
All right. Well,
Thanks for having me.
Awesome. Everyone has my contact information, so if you want to get connected with Robin, you can reach out to her directly, or you can reach out to me, and I can connect and kind of facilitate the conversation. So thank you for everybody's time, and have a good afternoon. And a special thanks to Robin. Really appreciate this. This was very helpful. All right.
My pleasure. Thank you so much. Thanks for organizing this, and nice to see everyone.
Yeah. Thank you.
Bye.
See ya.
Thanks. Bye.